What's up, everybody? How you doing? My name is Fitz, the acupuncture physician. Thank you for joining me on another live session. So, on this video, on this live stream, we're gonna go. I'm gonna talk about certain medical conditions that acupuncture can treat. I'm gonna talk about. I'm gonna go over, the diagnosis or the pattern of, we should say, and also the point protocol, for treatment, and also the herbal formula that we may use for that condition. Before I begin, I just want to say this is the perfect video for acupuncture students or actual acupuncturists. But if you're not an acupuncture student or acupuncturist, you can still listen, of course. But this video is for educational purposes only. I can't stress this enough. This video is for educational purposes only, okay? You should never self-diagnose. Always consult your regular doctor or acupuncturist if you have any questions about your health. But definitely always contact your primary physician first if you have any questions about your health, okay? All right, so now we got that out of the way. We're gonna go over some critical medical conditions that acupuncture works wonders for. All right, so please, when you come in, smash the like button. Let's spread this video around. Okay, this video needs more love so we can spread the word about acupuncture. You feel me? All right, so give me a second, everybody. The word about acupuncture. You feel me? All right, so all right, first condition is let's talk about migraines. Migraines characteristics: recurrent neurovascular headaches with or without associated visual and gastrointestinal disturbance. Sometimes migraines can begin between 10 to 30 years of age, and for whatever reason, it's more often found in women. Women, on average, have more migraines than men. When it comes to the reason or the causes of migraines, it can vary, right? When it comes to any type of medical condition, genetics always plays a role for some people, not all people, for some people. Also, another causes of migraines could be depression, hormone imbalance, certain food like MSG, like alcohol, cold cuts, cheeses. Stress can cause migraines. High altitudes. If you're somewhere high, that can cause migraines. Changing the weather, changing the weather pattern. Strong odors can actually initiate migraines for some people. And long hours in front of the computer because you're straining your eye muscles, and that can cause issues with migraines. All right. Symptoms may vary. It can affect the whole head sometimes, the migraine, or it can be hemilateral, one side of the head. All right. When it comes to Chinese medicine, as an acupuncture physician, when someone presents to me with a headache, I always ask him or her which part of the head is the headache more often. Is it on the side of the head, the front, the back, or the top? That would tell me a lot. Other symptoms could be nausea, vomiting, photophobia, photophobia, which is um, light induced. Those are common symptoms. Okay, attacks can last hours or even days, y'all. Treatment options in Western medicine sense could be avoid trigger foods such as alcohol, you know, such as chocolate, coffee, old cheese, MSG, nitrates, and artificial sweetener. When it comes to traditional Chinese medicine, migraines can be characterized by different patterns. Remember, in Chinese medicine, we don't do diagnosis; we find the pattern, right? So one pattern can be liver over liver over liver overacts on spleen and blood deficiency. So how can you tell if a person has a migraine and you know how can you tell if it's liver overacting on the spleen and blood deficiency? Well, it's gonna have hemilateral headaches, saying on one side, occur often in women during PMS. So if a woman is doing her cycle and she's having a headache on one side of the head, that could be a sign of that liver overacting on spleen, blood deficiency. Blurred vision. Why? Because the liver opens up into the eyes. Photophobia, numbness and tingling of fingers and toes. The liver Um, is in charge of the free flow of chi and blood. So if it's having issues, it can cause less blood to go to fingers and toes. Breast distension, sighs a lot, like she may feel depressed, fatigue, cold hands, cold feet, alternating constipation, and diarrhea. Now, every time you see alternating constipation and diarrhea, most of the time it's liver overacting on the spleen. All right, the tongue is going to be pale because of the blood deficiency. The pulse is going to be wiry and thin. Wiry because liver is involved, and thin because of the deficiency. All right. So herbal formula for that could be chaya sun and seaweed tongue. Chawa sun and seaweed tongue. Excellent food. I love chaya sun. Works wonders, and also seaweed tongue. Right now, point prescription can vary depending on the acupuncturist, but you best believe that certain points you definitely have to. I would definitely recommend putting for this type of patient, and they are liver 3, Li4, which is the 4 gates, do 20, which is the most high, which is the highest point on our body, do 20, PC6, gallbladder 20, Taiyang, Yintang, and and Ashi points. All right, so those are the points I recommend for that. Of course, you can add your own points or delete some, but in general, you probably want to do those points, right? Now, let's say the person comes in and you suspect liver yang rising. So the symptoms are going to be distended headaches behind the eyes, temple area, and the temple area, all right? Dizziness, severe pain at night, photophobia, anger, insomnia, tinnitus, and bitter taste, all right? Liver yang rising. Remember, in liver fire blazing, the eyes are gonna be red. But in liver young rice, the eyes are not gonna be red, right? The tongue is gonna be red with a yellow coating. What a yellow means, heat. It indicates heat. Pulse is gonna be wiry because the liver is involved, and rapid because of the heat, right? Herbal formula is a wonderful formula called Tima Butanyan. That's a wonderful herbal formula for that. It can help bring down the fire, right? Because remember, in Chinese medicine, headaches can be caused by heat rising to the top. M- Remember, heat rises. So that's why Tima Butanyan is a good formula for this type of migraine. The points are going to be liver 2. Why liver 2 is is a great point to release heat, especially in the liver channel, especially for headaches. Kidney 3, GB20, perfect point for headaches also. Taiyang, do 20, and bleed Ashi points. You can bleed Ashi points. Why? Because the Ashi points, by bleeding them, the hope is to bring down the heat, bring down the yang, because it's rising. And chances are the blood pressure for this patient might be high also, right? So another pattern could be liver overacts on stomach and cold invasion. Symptoms are going to be severe headaches at the vertex of the top, chilly sensation on the vertex, right? Remember, the liver is overreacting on the stomach and cold. Cold body, vomiting clear fluids, clear meaning cold, right? The tongue is going to be wet coat because the cold can cause dampness, especially when it comes to the spleen. Vomiting clear fluid, yes. Pulse is going to be wiry and tight. Tight because of the cold pattern, because of a cold invasion. Cold is going to make the pulse a little tighter, but definitely wiry because the liver is involved. The herbal formula for this one is going to be Wuzu Yutang. Perfect formula for this, all right? The acupuncture points are going to be stomach 36, Ren 6, do 20, GB 20, kidney 1, with for some patients, they could find very painful, Ren 13, and PC 6. If you suspect the patient, let's talk about a pattern for phlegm stagnation. Phlegm stagnation, headache, dizziness, heavy head filling, that's the phlegm causing that, like a tight band wrapped around the head, nausea, vomiting thick fluids, hence the phlegm, fatigue, anxious. Tongue's gonna be pale with teeth marks, because you know, and a thick, greasy coat. Greasy definitely means phlegm, all right? Part's gonna be slippery because phlegm. The herbal formula is gonna be Banyang, sorry, Ba Mashi Ba Zutang Matang. That's gonna be the herbal formulas. Point prescription is gonna be stomach 40. Stomach 40 is stomach 40 is the number one point for phlegm obstruction. Okay. Spleen 9 is also good for it's good for dampness. Stomach 36, do 20, GB 20, Ashy points. You notice for all these patterns, GB 20 and do 20 shows up each time. Take note of that. Blood stasis. Let's say a person has a migraine and you suspect blood stasis, it's going to be enduring long lasting headaches that won't heal. Fixed stabbing pain. Remember, when you see stabbing pain, that usually refers to blood stasis. Okay? Tongue's going to be purple because of the blood stasis and choppy. Herbal formula is going to be tongue chow, hu, hu shui tongue. All right? Points are going to be the four gates liver, Li4, liver 3, spleen 10. Spleen 10 is good for the blood condition, toxins in the blood, or for blood stasis in general. Do 20, GB 20, and Ashi points. So these points, these patterns and points are what you're going to look for if a person presents with migraines. You do your initial diagnosis, your initial exam from head to toe. Make sure you ask the right questions. Don't be afraid to ask the right questions or just any question in general. And then you make your pattern differentiation out of those exams. Okay. So so this is about migraines. Hopefully you learned something. Remember, this is for educational purposes only. So don't try to do anything with this as far as, don't try to treat yourself. Okay, people? So I just want to say thank you everybody for listening to me. I appreciate y'all. And then I'm gonna catch y'all next time, all right? Um, but before I go, are there any questions? Let me know. Are there any questions? So I'm thinking, should I do like another pattern? I don't know. Should I do another pattern? I'm in my car chilling, y'all. Just chilling in my car right now. Hopefully, everyone's having a wonderful day. Now, let's see. Should I go over another pattern? I think I'm gonna take this pattern for now. All right, everybody. So thank you for joining me, and then I'll probably do anxiety next time I go live. I'll let y'all know. Okay. Thanks for watching me, y'all. I'll check y'all later.